Keke Palmer is pregnant! Yay! Keke announced her pregnancy to the world on the 3rd of December while hosting Saturday Night Live. It's such a cute clip. Please go ahead and check it out. She basically goes out there and says, I've been hearing lots of rumors. People are saying Keke's pregnant and I just want to set the record straight. I am! And then she opens her trench coat and reveals this absolutely adorable pregnancy belly. Congratulations, Keke Palmer. So for those of you who don't know Keke Palmer, she is an actress and singer, and she started off her acting career as a child star. And the entire PCOS community is rallying behind her in support and celebrating along with this actress. In fact, PCOS was trending on Twitter for all the right reasons. And part of the reason is because women with PCOS are often told that they will never be able to conceive or that they will have a lot of trouble having a baby. And so Keke's pregnancy announcement is just an incredible opportunity for us to celebrate and bust some myths. So it is possible to fall pregnant or become pregnant if you have PCOS. So if you have no idea what PCOS is, PCOS stands for Polycystic Ovarian Syndrome, which is the #1 endocrine disorder in women of reproductive age. And it is a whole body disease, and it results in a number of symptoms, including things like irregular period, acne, excess hair growth in unwanted areas, hair loss on the top of your head. It can result in weight gain, anxiety, and other mood disorders. The list seems to go on and on. Now, Keke took to social media in 2020 to announce that she was battling with polycystic ovarian syndrome, and her case is not uncommon. In fact, her main struggle was with her skin, and she wrote on her Instagram, "The least harmful thing PCOS can bring is acne. To all people struggling with this, please know that you are not alone and that you are still so effing fine. My acne ain't never stopped me, but we don't have to accept this." Now I can really help Keke, and I love her, so it's on. Now, the reason why she was sharing this is because Keke took a long time before she actually received the diagnosis of PCOS. And so she battled for a long time with her acne. You can imagine, she's in show business, right? So she needs to be looking her best on screen. And so if your skin is acne prone and if you have lots of scarring, it can be very difficult to cover that up with makeup. And so she even wrote that somebody offered to pay to fix her skin for her, not realizing that, she was really trying her best. She had been to multiple doctors. She tried Accutane twice. She also had changed her diet. She was doing all the things, but nothing was improving her acne until she started doing her own research and digging a little bit deeper, and she found that there was a large group of family members of hers that actually were diagnosed with type 2 diabetes. And that led her down the rabbit hole of research to discover that she could potentially have polycystic ovarian syndrome, and that it was possible that some of her relatives may have also had the condition and went undiagnosed, because PCOS does put you at risk for developing type 2 diabetes. And so it was her research and her investigations and her just, I guess, knowing that something was not right that caused her to connect the dots and take that to her doctor and say, hey, maybe we should look for PCOS. What do you think? And eventually her doctors actually confirmed her diagnosis. And so when she was putting herself out there on social media very bravely and very admirably, she was actually rejoicing that finally she came to a diagnosis, and now she was able to do the healing work that was required in order to manage her symptoms. So PCOS is one of those roller coaster disorders. It really can make you feel very self-conscious. And she mentions, that acne is like the like one of the minor symptoms of PCOS. But if you combine that with, low opinion of yourself and low self-esteem, then, and also the mood disorders that you can experience if you have PCOS, it can actually be quite debilitating and quite depressing. If you've ever had acne or if you have PCOS and you battle with acne, then you know what I'm talking about. But with regards to the fact that she is pregnant, this is amazing news, because we know that usually people with polycystic ovarian syndrome, they don't ovulate frequently. And that's really it's one of the major parts of the problem. It's like a puzzle piece that, because there's lots of different puzzle pieces that come together to create this syndrome of PCOS. And one of those big puzzle pieces is a lack of ovulation. And so if you're not ovulating, basically if a mature egg is not released from your ovary, then there's nothing to get fertilized. And so people can often battle for years to conceive, not knowing what is going on. And that's often the reason why they end up going to the doctor's office and discover that they actually have polycystic ovarian syndrome. And so this is amazing news. Unfortunately, it can also be triggering news. For people who are battling with fertility, hearing about other people's pregnancies can make you feel like hopeless. Okay, so for some people, they're celebrating. A lot of people on Twitter, went out and said, oh, this is amazing. Hearing that Keke Palmer is pregnant and knowing that she has PCOS gives me hope, because I have PCOS and I was told that I would struggle to have babies. And now that I know that she's pregnant, I feel positive. But for some people, it can actually be quite triggering, because they can feel like, when is it going to be my turn? When am I going to also be celebrating a pregnancy, especially if they've been battling for many years to conceive? And so, yes, getting pregnant is amazing, and it is something that is achievable. So I want to give you hope. I want to just encourage you not to ever give up. Don't lose hope, okay? Because half of the battle is in your mind. There's a lot of things that you can do to try and increase your chances of getting pregnant. And let me know if you want me to talk about some of those things in another video. But just importantly, remember that while this struggle is real, okay, your feelings are valid and you are absolutely well within your rights to feel depressed and sad and disheartened about the fact that it's so hard for you to conceive. And it's almost like so easy for other people to just get pregnant. So I just want to say, don't lose hope, don't give up. And yeah, let me know if you want me to share some more information in an upcoming video about some of the things that you can try to do to increase your chances of conceiving. But it is important to remember that once you hit pregnancy, that's not where it ends, okay? So PCOS is one of those conditions where, unfortunately, in pregnancy, there are many risks associated. And so if you are newly diagnosed as pregnant, congratulations, first of all. Just make sure that you are following up closely with your antenatal appointments, because in PCOS, there are some risks associated. So there's a 3 times increased risk of miscarriage in early pregnancy with polycystic ovarian syndrome. But also, it's important to note that PCOS can put you at risk for developing complications such as gestational diabetes. So this is a type of diabetes that happens in pregnancy. Also, it can put you at risk for developing hypertension or high blood pressure in pregnancy. And especially it can put you at risk for developing a specific condition known as preeclampsia. And preeclampsia is a condition where you have high blood pressure associated with protein in your urine. And so the only way to know that you have, or that you may potentially have these conditions, is to follow up regularly and make sure that you are attending your antenatal visits as scheduled. Some of the other symptoms of preeclampsia is that you may experience excessive puffiness, you may experience leg swelling, and these are symptoms of normal pregnancy. But if you are regularly checking your weight and making sure that you are keeping on track of your urine tests, then you can ensure that you're able, or your doctor's able, to diagnose this condition early. And so that's just an important point to also highlight, is that getting pregnant is half the battle. Staying pregnant and also making sure that your risks are appropriately managed is the second part of that. And so if you are new to this PCOS thing, or even if you feel like you have been struggling to manage your symptoms, you are experiencing uncontrolled acne, you are gaining weight regardless of what you're doing, you tried every diet under the sun, you're exercising, you're doing all the right things, and you feel like you are ticking all the boxes, but you're not seeing the results that you expect, then check out my PCOS Made Simple ebook that is linked in the description box below. It's basically a very simple ebook that will give you the basic facts of PCOS, but also it will walk you through identifying your PCOS type, because there's more than one type of PCOS. And it's important for you to know which type you have so that you know what you specifically need to do to manage your specific symptoms. So you can go ahead and check that out in the description box below. And thank you for being here. I'm Dr. Carmen, integrative doctor and health coach, helping you fix your period problems naturally. And if you enjoyed this video, go ahead and subscribe, give me a thumbs up, and it helps me to share this information to more people. And so if you would like to, go ahead and check out this video next, because this is the video that YouTube thinks you should watch. Until next time, take care.